Good evening, I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling long distance, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne's Bruce Haynes studio. And if you have any questions concerning mental health issues, you may write me at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email I recently received. Dear Dr. Fawver, my pharmacist told me that brand name Prozac is no longer being produced by the manufacturer. Other pharmacies told me the same thing. I've been taking this medication for 28 years now, and I don't like being forced to stop it. Please help. Well, I understand the reference to which you're describing because Taiwan produced most of the brand name Prozac until December of 2024. So we've been without brand name Prozac since the year of 2025. Lilly originally researched and promoted and manufactured Prozac back in 1987. That's how long it's been on the market. And then it was handed over to outsourcing in the international countries after it went generic, in the early 2000s, I believe. So it's been generic for quite some time. Now, generic Prozac or generic fluoxetine versus brand name Prozac, what's the difference? A generic medication can give you about 80% to 125% the bioequivalence of the brand name. Now, what that means, if you've been taking 20 milligrams of brand name Prozac, and it says it right there on the bottle, if you take a generic version, you could get as little as 16 milligrams. So how do you get the extra 4 or 5 milligrams? Well, you can be creative with a generic, assuming you're getting the lesser amount in the generic. And quite frankly, most people, when they use a generic, are getting the lesser amount. They're getting more toward 80% as opposed to the 125% that they could be allowed. Brand name Prozac, what you've been taking, spot on. It's right at 20 milligrams very consistently. But the generic fluoxetine that you would have available, you might be getting the equivalence of maybe 16 milligrams of fluoxetine for a 20 milligram dose. So how do you make up the extra 4 milligrams? Well, you can be creative about it, and you really want to talk this over with your clinician and find the generic version that works the best for you. But if you're finding that a generic version at 20 milligrams just isn't doing the job for you, you could still possibly use that generic version, and you'd have to be creative in how you would use it. For instance, with Prozac, it has a long half-life. That means it stays in the system for days. So you wouldn't have to take a consistent dosage every day to get a steady blood level. So with fluoxetine or Prozac, you could take 20 milligrams on Monday, 20 milligrams on Tuesday, 20 milligrams on Wednesday, and then 40 milligrams on Thursday. So for 1 day out of 4 days, you could take a 40 milligram dosage. That would give you an average of, let's say, 100 milligrams over the course of 4 days, which is 25 milligrams. That's how you get a 25 milligram dosage of generic fluoxetine that might be somewhat equivalent from a bioequivalent standpoint to brand name Prozac 20 milligrams. So there's ways we can get around that. So that's one option. You could stay on fluoxetine that way. And fluoxetine is subtly different than from the other selective serotonin reuptake inhibitors and their SSRIs. You have Zoloft, Lexapro, Paxil, Celexa, Luvox. These are all SSRIs, and they all have subtle differences, and that's why some people will do better on one versus another. But if you've done well on brand name Prozac, you can either try generic Prozac, knowing that you might need to take a higher dosage in some cases, or go to another SSRI, Zoloft, Celexa, Lexapro, Paxil, Luvox. Go to another SSRI to see if that would give you similar effects one way or another, and that would be assuming that the generic fluoxetine or the Prozac would fail on you. So there are a lot of options out there. Yep, I've heard the brand name Prozac is no longer available on the market. Thanks for your call. Let's go to our first caller. Hello, Margot. Welcome to Matters of the Mind. Margot, you want to know what causes stress related headaches, what's happening to your brain. When you have stress, Margot, it'll cause you muscle tension, not uncommonly. And some people get neck aches, back aches. And you can get a headache because we've got this skull that surrounds our brain. Our skull is thick, it's hard, and it's not going to move. So when you're a little thin muscles, all around the scalp, clamp down, and they get a little bit tight, you're going to get a headache. And a headache, with a tension headache, it's like a headband. It goes around the forehead, around the sides, and the temple area. It's like a headband, and it will come on with stress. If you exercise, especially resistance training or weight training, that is particularly good for stress-related headaches. Now, there are headaches that are related to high blood pressure, a whole different phenomenon. High blood pressure headaches can be dangerous because you can have a hemorrhaging of a blood vessel. That's never good. So high blood pressure would always need to be controlled. Sinus headaches are usually associated with a fever and congestion. And if you tap over certain parts of your head, you'll notice particular pain. Migraine headaches will often be on one side or another, and they are incapacitating. Migraine headaches often have an aura where you'll notice them coming, you'll feel them coming on, and then when you have a migraine headache, you just can't do anything. Light sensitivity, sound, any kind of movement can bother you, and not uncommonly when people have a migraine headache, they just need to lay down. There are other types of headache, but those are the main ones that people will experience. But a tension headache is basically the thin muscles around the actual skull itself clamping down, and they're not incapacitating, but they can be really, really annoying. Thanks for your call. Let's go to our next caller. Hello, Gary. Welcome to Matters of Mind. Gary, you'd mentioned that you take buspirone, and you wonder if you could take blood pressure medication with that. The easy answer is yes, you can take blood pressure medication with buspirone. Buspirone is a medication that's very selective in what it does. It will give you a thermostat-like effect on a particular type of serotonin receptors. There's 14 different types of serotonin receptors. Buspirone is working on serotonin receptor number 1A. And if you stimulate serotonin 1A receptors or block it accordingly based on the amount of serotonin in the system, it can help with worry and anxiety. So buspirone is helping with worry and anxiety, but it has no effect on the blood pressure. A side effect of buspirone can be early on dizziness and sometimes double vision, but that's a brain phenomenon. That's not a blood pressure phenomenon. So if you're taking blood pressure medications, they would not typically interact with buspirone, and buspirone would not be affecting the blood pressure itself. Thanks for your call. Let's go to our next caller. Hello, Claire. Welcome to Matters of the Mind. Claire, you'd mentioned your daughter is on Zoloft, but she went to camp, did not take it the whole summer. Now, you want to know, should you resume her dosage, or do you need to contact your provider? Well, the safe answer is always to contact your provider and talk this over, as opposed to some psychiatrist on TV like myself. But I'll give you some ideas here. The first question you want to ask is, does your daughter still need the Zoloft? Why was the Zoloft being used? Was it due to depression, irritability, anxiety, anything incapacitating that was really relieved with the Zoloft? When she went off of it, how did she do? So you always have to weigh the need for the Zoloft over the course of this fall as she goes back in the school year. Now, if she does need it for social anxiety, she needs it for panic attacks, obsessive-compulsive symptoms, whatever may have been there before the Zoloft was used, you could always resume the Zoloft, and again, with your provider's direction, depending on the dosage she was taking. If she was only taking 25 milligrams a day, she could go right back on 25 milligrams a day. Usually if somebody is on 50 milligrams a day, you want to go 25 milligrams a day for about 6 days, then go to 50 milligrams. Same with 100 milligrams. You want to slowly titrate the Zoloft, where she would take 25 milligrams a day for 6 days, 50 milligrams a day for 6 days, then go up to 100 milligrams every day thereafter. So you want to gradually move into it. If you start taking Zoloft at 50 or 100 milligrams a day right off the bat, sometimes you get stomach upset and diarrhea. It's not harmful, it's just that it's really uncomfortable. So with Zoloft, especially early on, typically people will take a lower dosage, often with food, because that'll decrease a lot of the gastrointestinal effects. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, with high school sports starting up again, are there any concerns for athletes who also take medications for depression, anxiety, or mental health conditions? It's still hot outside. I'm wondering, might there be additional risk for heat stroke or dehydration? Are there such side effects? There are certain medications that might give you more difficulty in the hot weather than others, and in playing sports particularly. If you're on a psychostimulant for attention deficit disorder, you can still play sports. As a matter of fact, if you're a point guard on the basketball team, if you're a quarterback on the football team, if you're a shortstop on the baseball team, you might actually perform better taking a medication like a psychostimulant if you have severe ADHD that's causing you to have difficulty paying attention to instructions. So you can take it. The key with any psychostimulant medication for ADHD is to make sure the blood pressure or the heart rate will not be too high. Some people will need to take lithium for mood stabilization. Lithium has a misperception that you can't sweat while you're taking lithium. That's ridiculous. You can sweat while you're taking lithium. It's just that you want to replace your electrolytes. So if you're taking lithium, you can sweat. It's just that you want to take some electrolytes every now and then. There are electrolyte drops people can take. There are sports drinks that have electrolytes in them. But with lithium, the key will be if you're sweating excessively, you're lowering your sodium level. When you lower sodium levels, lithium levels go higher. So you want to have some kind of salt replacement or electrolyte drinks or tablets to be able to replace that with something like lithium. With some of the medications, they can make you a little bit lightheaded. We don't use those medications so much anymore, but a few of the medications can cause your blood pressure to drop, and we've heard about that in times past more often than now. But talk it over with your clinician concerning what risks there might be with dehydration or playing sports, especially in the event that the blood pressure is increasing or the heart rate is increasing with physical activity. Thanks for your call. Let's go to our next caller. Hello, Maggie. Welcome to Matters of Mind. Maggie, you want to know about Zurzuvae, also known as zuranolone. You want to know it's used for postpartum depression, and why is it only taken for 4 days? Is it a cure for postpartum depression? Well, Zurzuvae, or zuranolone, is used for 14 days, Maggie. So yeah, it's kind of like an antibiotic in that way. After a woman delivers a baby, her estrogen and progesterone levels plummet, all right? So when the estrogen and progesterone levels plummet, you can have a loss of a particular byproduct of progesterone called allopregnanolone. Allopregnanolone mimics a Xanax or an Ativan or a Klonopin or a Valium type effect in the brain. In other words, allopregnanolone is very calming on the brain. With the loss of allopregnanolone, because you don't have as much progesterone, you can have a lot of trouble with depression, anxiety, difficulty with sleep, poor concentration. It can cause a lot of bad things. So what Zurzuvae is basically a chemical analog or a chemical lookalike to allopregnanolone. Your brain thinks it's getting allopregnanolone. You use it for 14 days, and in the clinical trials for postpartum depression, it has been very helpful during those times, and we've used it extensively in our practice. It's 50 milligrams every evening with food. It gets absorbed best if you take it with a fatty meal. So it gets absorbed in the evening. You can't drive or operate machinery for 12 hours thereafter, so we often recommend to people take it at 6 p.m. or 7 p.m., and then they are able to sleep throughout the night, and it's out of their system by the next morning that they can drive. If you have little ones at home, I often recommend that you have somebody else kind of keeping an eye on them just in case you're overly sleepy and you can't attend to their needs after taking Zurzuvae. Some people are very sedated. Most people aren't that sedated, but that is a side effect. It's only for 14 days that you're taking it. Is it a cure for postpartum depression? Generally, about 3 out of 4 people are going to take the 2 weeks of treatment for postpartum depression, and that's it. They don't need further treatment. Now, you can take another antidepressant with it. So Zurzuvae is affecting so-called GABA receptors, but other antidepressants that affect serotonin, norepinephrine, dopamine, even glutamate can be used with Zurzuvae, and you might actually get a better effect in those cases. But if you just want to take one medication for postpartum depression to try to balance out that hormonal change that's occurring following delivery, Zurzuvae or zuranolone is an option. There is a medication that has been around for longer than that. Brexanolone is an IV medication. It's used over the course of an inpatient stay. You're in the hospital for 2.5 days, and during that inpatient stay, you're getting this IV formulation, and that's it. But that was causing a lot of clinicians to find it somewhat burdensome to use. We prefer Zurzuvae because it's a couple capsules of 25 milligram capsules. People get it through a specialty pharmacy. They get it in the mail. It's a scheduled medication. It is controlled because it can give people a bit of a buzz and sedation after taking it. But people take it over the course of 14 days with or without an antidepressant medication. And in our experience, we've had a lot of good luck with it for postpartum depression because it's actually treating the underlying condition. If you don't typically have that much depression the rest of your life, but you really notice you get slammed with depression right after delivering babies, yeah, Zurzuvae can be a really nice option for correcting that. Thanks for your call. Let's go to our next email question. Our next email question reads, Dr. Fawver, is therapy using psilocybin showing any promise? I've been doing some reading and I'm wondering if it might be helpful to a family member. Psilocybin is being used clinically in Oregon right now, but no place else in the United States. Australia has been using psilocybin for treatment-resistant depression for this past year. Psilocybin is a derivative from mushrooms. Psilocybin breaks into psilocin, I believe the pronunciation of that is. It's the metabolite, and that is what's affecting serotonin type 2A receptors. And if you stimulate serotonin type 2A receptors, you can, number one, kind of jar the brain out of this funk that it gets in when people get depressed. When people get depressed, they get into this ruminative stuck phase, and it's called default mode network, where you have your salient network, you have default mode network, and you have the executive network. And when people get stuck in the default mode network, they just can't They can't think clearly, they ruminate about things, they dwell on things, and what psilocybin will do is kick people out of that particular network. It also has some nice, what we call downstream effects by stimulating indirectly the natural brain fertilizer called brain-derived neurotrophic factor. So it's stimulating brain fertilizer to make the little neurons more fluffy, and it does so very quickly. By my understanding, we might see psilocybin being FDA approved, probably first for postpartum depression as early as 2027, as late as 2030. It all depends on how the studies go. There has been a study that was successful using psilocybin with Zoloft, which I mentioned earlier. Zoloft is sertraline, it's an SSRI, and it's a serotonin antidepressant, but using psilocybin with Zoloft was successful. But I think we're about a couple years away from seeing it FDA approved across the United States. First for postpartum depression, first for treatment-resistant depression, then maybe for post-traumatic stress disorder, probably for addictions later on. So it can be used for a lot of different type of treatments. It's going to be recommended to be utilized in a very controlled setting. So a clinician, possibly a therapist, or at least somebody supervising the actual administration of psilocybin will be in the same room. We do the same thing with Spravato right now. Spravato is a nasal spray that's the active metabolite of ketamine. Spravato is S-ketamine, and people will come into the office and they'll sit for 2 hours after they get the S-ketamine spray. They come in twice a week, and it's a supervised setting to make sure they're not having any adverse side effects, and they can be addressed with those side effects if any of them occur. Psilocybin is the same way. We're not going to give psilocybin to people and have them take it home and use it on their own. They're going to be using it under a very controlled setting. Thanks for your call. Let's go to our next caller. Hello, Ann. Welcome to Matters of the Mind. And you'd mentioned you're looking for a cheaper substitute for the medication called Trintellix. Are there any more cost-effective alternatives for major depressive disorder? Trintellix is going to be generic later this next year, I believe, 2027. 2026, I think it goes generic. So it's going to be getting cheaper and cheaper. It's already getting more accessible in a lot of different insurance plans, and so I'm having more luck prescribing Trintellix than I had in the past, so it's getting more accessible in that way. Trintellix is fairly unique. It does have serotonin reuptake features, but it does affect 5 of the 14 different serotonin receptors somewhat uniquely, so it's kind of honing in on what really needs to be affected. So Trintellix, as opposed to other medications that affect serotonin, Trintellix is going to be more likely to give you more energy, more motivation, better concentration, less weight gain, less sexual disturbances, fewer side effects in general. Nausea can be the only side effect of Trintellix early on. But you can talk to your clinician about what you've tried, what worked and what didn't work, and look for different options out there. You can also see if your insurance plan is covering Trintellix a little bit better now than it might have in the past. So for instance, you might have tried to take Trintellix 2 years ago and you found it to be too expensive. You might find that now it's not as expensive. And you can also ask your clinician about the possibility of a Trintellix savings card. If you have commercial insurance, Trintellix savings cards can be obtained online, and that can sometimes keep the cost of commercially insured patients on Trintellix down to no more than $10 per prescription. So there are ways to get around that, but Trintellix is fairly unique. We can't put some generic concoctions together and come up with Trintellix. It's fairly unique in what it does. And thanks for your call. Let's go to our next caller. Hello, Gordon. Welcome to Matters of Mind. Gordon, you want to know, can anxiety be caused by anemia? How are they connected, if so? Anxiety with anemia, the best I could probably say could happen there, Gordon, would be if you have anemia, you can feel tired, you can feel kind of foggy, but a symptom of anemia can be a fast heart rate because your heart's pumping faster, trying to get the blood flowing around because it realizes that you're low on oxygen because of anemia. So if you notice that your heart's pounding faster and faster and faster, that can be related to anemia. But the main problems we often hear about with anemia will be such conditions as fatigue, poor concentration. People sometimes will feel lightheaded, but the fast heart rate is something we do hear about with anemia, not uncommonly. Thanks for your call. Let's go to our next caller. Toby, welcome to Matters of Mind. Toby, you had asked, what can brain scans reveal about your mental health? I wish they would reveal more, Toby. When we do brain scans, there's MRIs of the brain. They give you a magnetic resonance. They give you a really nice picture of the brain itself. But what we need are more functional MRIs, and they're done in research, but they're not done practically. Functional MRIs is where you're doing something, you're concentrating on something, and the researcher is watching what's happening in the brain. And it gives us an idea on how the brain functions when you're performing tasks. For instance, this dorsolateral prefrontal cortex up here is working really hard when you're concentrating on something that's not that interesting. So that sometimes is something that we'll consider. Can SPECT scans, which have gotten popular over the past 20 years, can they give you diagnostic assessments? When you do a SPECT scan, the problem with a SPECT scan, it's like watching 2 minutes of a 2-hour movie. And you're just watching it very briefly. And if you watch 2 minutes of a 2-hour movie, you're probably not going to be able to figure out the 2-hour movie. And that's the limitation of SPECT scans. They're very transient. In my experience, people who have had SPECT scans who have recommendations based on those SPECT scans, they're not highly meaningful. So when we do an MRI of the brain, for instance, we are looking for tumors, we're looking for strokes, we're looking for specific pathology, maybe a cyst that might have caused problems that would be unexpected for a person's age and their family history. So let's say somebody has psychotic symptoms, they're out of touch with reality, and they have no family history of schizophrenia, they have no drug use, all of a sudden they have these symptoms that just come out of nowhere. Yeah, you might want to get an MRI in those cases. I find those to be most meaningful. But functional MRIs, I think, might in the future give us a little bit better direction because they are actually showing how the brain is processing information in real time. SPECT scans, not so much right now. So right now, we're not doing a lot of imaging in the use of psychiatry in general. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I delivered my daughter 9 months ago and I have struggled with postpartum depression since. I have been using Zoloft since and my liver tests have gone higher. This has happened with other SSRIs. What are my options for treating postpartum depression? Well, Zoloft is one of our go-to medications with postpartum depression because it's relatively safe with breastfeeding. But if your liver tests are going higher on Zoloft each time you take it, and with other selective serotonin reuptake inhibitors, such as Lexapro, Celexa, Paxil, Prozac, that class of medications might not be in your best interest. So what do you take in those months after you deliver a baby if you're having a lot of depression? I mentioned Zurzuvae earlier as a possibility, but there are other medications such as Pristiq, desvenlafaxine. It's the breakdown product of Effexor or venlafaxine. It's kind of like a digested Effexor because it doesn't go through the liver, it goes through the kidney. So that would be a safe option. Another safe option could be bupropion, Wellbutrin. Wellbutrin's been around for a long time, and both Pristiq and Wellbutrin would be safe during breastfeeding. So the main medications we use in postpartum depression, the traditional medications would be Zoloft, Pristiq, Wellbutrin can be used, duloxetine, Cymbalta can be used, but that does go through the liver. Wouldn't recommend that if you're having liver problems from Zoloft already. But if you're having liver problems from Zoloft and other SSRIs, I'd probably go with something like Pristiq, Wellbutrin, or Zurzuvae as my main options to consider. So talk that over with your clinician. Thanks for your call. Let's go to our last caller. Hello, Brian. Welcome to Matters of the Mind. Brian, you'd mentioned you've been self-medicating with alcohol to calm down after work, but you're still having panic attacks. Why is this having an opposite effect? It's because you're getting, well, to say it somewhat harshly, addicted to alcohol, because as your brain needs alcohol to get that calming effect, you need more and more of it. So you could actually be going into some withdrawal, even several hours or even a day after you drink the alcohol. So what I suggest, Brian, is that you talk to your clinician about detoxing you from the alcohol. We not uncommonly will use a medication like Neurontin or gabapentin, sometimes Lyrica, also known as pregabalin. These medications will dampen down the withdrawal from alcohol and help people with anxiety related to those kind of conditions. A lot of people used marijuana in the past, same kind of scenario where we are using gabapentin, pregabalin to help people get off the marijuana, because many people will self-medicate with alcohol or marijuana to calm down panic attacks, but it sometimes makes them worse. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.